Mr. Speaker, May is Cystic Fibrosis Awareness Month. Now, Ontarians living with cystic fibrosis have waited too long for life-changing drugs that could transform their lives. They're available in other countries around the world, but not here. Trikafta is a transformational drug that can treat up to 90% of Canadians with CF. The federal government is poised to end the review and provide recommendations by the end of June. In England, the National Health Service finalized negotiations with the manufacturer and agreed to fund the drug before regulatory approval. Ontario can do the same, Mr. Speaker. Will the government negotiate with Vertex immediately so that once approved, this drug can be prescribed to desperate CF patients as soon as possible?
To reply, the Minister of Health.
Speaker, and thank you to the member very much for the question. This is an important issue, I know, to many Ontarians. And Trikafta has shown great promise as an effective treatment for cystic fibrosis patients, and this is an important step for CF patients to be able to access new drug therapies such as Trikafta in Canada. Our public drug programs look forward to continuing their discussions with Vertex as Trikafta moves through the steps in the drug review process, which includes, of course, approval by Health Canada for sale in Canada, a review of the clinical and cost information through a health technology assessment, and finally reaching successful pricing negotiations with the PCPA, the Pan-Canadian Pharmaceutical Alliance. So it is working its way through the system. We are doing whatever we can to follow up and to work with Vertex so that these products can be available to cystic fibrosis patients in Ontario.
The supplementary.
Thank you, Mr. Speaker. My supplemental is for the Minister of Health. 12-year-old Camille Rochon from Orleans is one of the many cystic fibrosis patients in Ontario whose life depends on timely access to Trikafta. Now, it appears, based on that answer, that Trikafta will be delayed by the same healthcare red tape that has delayed so many other groundbreaking treatments here in Ontario that are available in other parts of the world. Every day that passes without access to these medications means more sickness, more hospital visits, and even more death. Mr. Speaker, the Premier, his minister, and this government has the power to get Ontarians with CF affordable access to Trikafta. He could help, and the minister could help, the vast majority of CF patients have a brighter future. I know that the minister wants to say yes, so just say yes. Will you ensure that Trikafta is available at an affordable price here in Ontario the moment it receives federal regulatory approval?
Health.
Very much, Speaker, and thank you again for the question. Of course, we want all of these new drugs to be able to be approved and to be able to be available for people, and I know that many people in
the Environment, come to order.
Cystic fibrosis community are looking forward to having this approved, but you will also know that there has to be a process to make sure that we take an evidence-based approach to the approval of these new medications by funding decisions that considers the clinical effectiveness of the drug, the safety, patient input, affordability, and effects on other health services. So, of course, I am as anxious as anyone else is to have these drugs approved because we want to be able to help people with cystic fibrosis lead more normal lives. I know that life is very difficult for them, and I am speaking with my ADM in this area on a regular basis to understand where the system is, and anything that we can do in the Ministry of Health to move things forward, we certainly will do.